Okay, we're going to continue with the respiratory system. So the respiratory system enables the transport and exchange of waste materials and nutrients for use in cellular respiration. The main structures in the respiratory system start off with the nose and the mouth. These are the entry and exit points, and they are able to moisten and filter air through. This means that as air enters, especially in really cold climates, your nose and your mouth help to warm the air up a little bit so it's not as a shock to your system. Then we have the pharynx, and this is the common passageway for air, and it's the back of your nose and your mouth. The air goes down and goes into your trachea, which is your windpipe, and it's supported by cartilage, which lines your neck, which prevents the collapse of this wind air tunnel. Goes down into the bronchi, which is the airway to the lungs, and then it goes into bronchioles, which are just smaller broccoli-looking things that are a subsection of the bronchiole, and within each bronchi, and within each bronchiole there are alveoli, which are these air-filled sacs that allow for gas exchange. And they have a high surface area to volume ratio to ensure the rapid exchange of materials. And the bronchi, bronchiole, and the alveoli, they all lie within the lungs, which is within your thoracic or your chest cavity that's protected by your ribs, which is an element of your axial skeleton. So the blood that is pumped from the heart to the ribs via the pulmonary artery is high in carbon dioxide because this blood has been circulating around the body and it's already been used, and it's low in oxygen. So the blood from the heart, high in CO2, low in oxygen. Then after gas exchange happens, the blood returning to the heart via the pulmonary vein is then high in oxygen and low in CO2. And this is a process called gas exchange. So gas exchange is just the process of moving oxygen and carbon dioxide across the membrane via diffusion. And gas always moves from regions of high to low pressure. So within your alveoli, which are the air-filled sacs in your lungs, is the site of gas exchange, where when you breathe and oxygen comes in through inspiration, oxygen moves into your bloodstream because there is a higher concentration / there's higher pressure of oxygen from that breathing. And as we established, there is low oxygen from the blood from your heart. Therefore, the blood moves into your bloodstream. Whereas because there is lots of carbon dioxide coming back from the bloodstream from the heart, the carbon dioxide is moved from the bloods to the lungs for expiration, because when you're inhaling, there's less carbon dioxide, and then when you exhale, there's more carbon dioxide. This pressure gradient is maintained from fresh oxygen. So if we go back here, the blood from the heart is high in carbon dioxide, so the carbon dioxide diffuses into the area of low carbon dioxide and it's exhaled out. There's low oxygen and high oxygen from inspiration. So when you breathe, the oxygen goes back into the bloodstream where there's less oxygen there. And then during exercise, to meet constant muscular metabolic demands, there's increased ventilation rate because we want to continue supplying our muscles with the amount of oxygen that they need, which means there is a greater pressure gradient created and a faster rate of exchange. So now to look at the process of inhalation and the mechanisms of inhalation and what happens behind it. First off, when we start to inhale, and usually breathing is an involuntary process, you don't have to tell your brain to breathe. Your diaphragm, which is the muscle lying underneath your rib cage, it contracts and it pulls together and it flattens and moves downwards. This allows your external intercostal muscles, which is in the side of your body, to contract and pull your rib cage outwards. And because there is a constant amount of air in your thoracic cavity, which is your chest cavity again, because your ribs are expanding outwards, yet the amount of air molecules remains the same, the pressure is decreased because these molecules have more space to move around in. And so the outside air pressure is now greater than your lung pressure. Your lung pressure, again, is within your thoracic cavity. And air rushes in from the outside into the air inside to equalize the pressure, because gas always moves from high to low pressure regions. And then the opposite happens in expiration. Your diaphragm and your muscles relax. So if your diaphragm relaxes and it pushes back outwards, and your external intercostal muscles relax and push inwards, the volume of your lungs decrease and the pressure increases. So therefore now there's more pressure inside your lungs than there is in the outside environment. So the air rushes out of your lungs and into the environment to equalize the pressure between your lungs and the environment, because gas always moves from high to low. And during exercise, because we need to meet these additional metabolic demands, additional muscles are going to contract. We're going to use the internal intercostals to pull the ribs down and in, and the abdominal muscles to push the diaphragm up. And this allows for more forceful expiration, and it decreases the thoracic cavity pressure a lot faster, and it allows for greater ventilation to happen. And the equation we look at ventilation through is the minute ventilation equation, which is just the volume of air being exhaled and inhaled per minute. So minute ventilation is equal to tidal volume, which is the depth or the amount of air, times our breaths per minute, so respiratory rate. And ventilation increases in response to demand. If our body needs more oxygen or needs to expel more carbon dioxide, then our ventilation rate goes up by increasing both the rate of the breathing and also the depth of the breaths that we're taking. So that is kind of just a rough intro to the respiratory system.